So Dr. Varadachari is going to talk about how she has, with her committee, she has managed to provide a source of, continuous source of physicians to the hospitals in India that are doing these free charitable works to the Sathya Sai hospitals.
Hello. I love you all. Thank you all for being here. I want to thank Dr. Narendranath Reddy for giving me the privilege to present this topic of SSIO doctors' participation in Sathya Sai hospitals. Since hunger pains have started, I will deliver soon, so don't worry. Okay, next slide. Next slide, please. Is someone? I have no conflict of interest to disclose. Next.
If you want to use it.
No, can you use it? Can someone? Sure. Okay, this slide gives an overview of the activities of the SSIO doctors in Sathya Sai medical institutes in India. Number one, the doctors volunteer their services in Sathya Sai General Hospital and Sathya Sai Institute of Higher Medical Sciences in Puttaparthi and in Whitefield, Bangalore. Number two, the physicians participate in the medical service activities organized by the Sathya Sai International Organization as medical camps twice a year during Guru Purnima and birthday of Sathya Sai Baba, when thousands of people gather in Prashanthi Nilayam for celebration. The doctors also teach the postgraduate DNB fellows either on-site or by telehealth participation. Next slide. This slide outlines all the services available in Sathya Sai hospitals in Puttaparthi and Whitefield. Sathya Sai General Hospital in Prashanthi Nagar, Puttaparthi offers general medicine, OBGYN, pediatrics, general surgery, ENT, anesthesiology, and dentistry. Since Dr. Neelam has already described all the services of secondary and tertiary care available in Sathya Sai Institute of Higher Medical Sciences in Prashanthi Gram, Puttaparthi, I will not go through it in detail. Basically, as she said, cardiology, urology, ophthalmology, orthopedics, GI, endoscopic surgery, plastic surgery, anesthesiology, and diagnostic imaging. Sathya Sai Institute of Higher Medical Sciences again offers tertiary care, cardiology, CTVS, neurology, neurosurgery, and diagnostic imaging. Sathya Sai General Hospital in Whitefield, which is currently located in the same building, offers primary and secondary care, including orthopedics. Next slide. The Government of India and the Medical Council of India have certain requirements for doctors of foreign nationality to do medical service in India. Number one, they need to have a basic medical degree and specialty board certification. Number two, current active medical license in the country they live. Number three, temporary Medical Council of India registration valid for the period of their medical service in India. Number four, e-visa for doctors who do not have a permanent visa to India. The hospitals prefer at least 5 to 7 days of service, and the SSIO coordinators facilitate the doctors' rotation in the hospitals in consultation with the medical superintendent and the medical directors of the hospitals. Next slide. Regarding General Hospital, Sathya Sai General Hospital in Puttaparthi, patients receiving care in Sathya Sai General Hospital in Puttaparthi is phenomenal. More than 10 million outpatients and more than 250,000 inpatients have been treated since 1956. They also have a postgraduate DNB program in family medicine. SSIO doctors from 10 to 12 countries such as USA, Canada, Argentina, UK, Ireland, Germany, Austria, Malaysia, Sri Lanka, and Australia provide coverage in the hospital. This next slide, please. This slide illustrates the outpatient services given by the SSIO doctors in Sathya Sai General Hospital. Next slide, please. Regarding dental service rotations, 29 dentists from 7 countries, including India, provide coverage for the whole year in Sathya Sai General Hospital in Puttaparthi. They see approximately 70 patients per day, and the total number of dental procedures done by them since 2010 is more than 144,000. Next slide, please. SSIO doctors, as I said, offer their services in Sathya Sai Institute of Higher Medical Sciences, in Puttaparthi, and in Whitefield. Both institutions have state-of-the-art diagnostic modalities and infrastructure for high-quality free secondary and tertiary care, as outlined by Dr. Neelam Desai. They also have full-fledged DNB program in all specialties in their institution. Next slide, please. SSIO organizes international medical camps in Prashanthi Nilayam, Puttaparthi. Guru Purnima camp is held for 5 days, often in July. Birthday medical camp is held for 8 days, always in November from 18th through 25th. More than 100 volunteers from 18 countries around the globe participate and serve thousands of patients with utter dedication and unbelievable enthusiasm. The categories of volunteers include doctors, physician assistants, nurse practitioners, nurses, pharmacists, physical therapists, general volunteers, young adults, and high school students. Next slide. The total number of patients served by the SSIO healthcare team from 2005 to 2016 in these international medical camps is over 80,000. Usually they see around, on an average, they see around 3,000 plus patients during Guru Purnima and 6,000 plus patients during birthday medical camp. November 2015 was an exception when in 8 days they saw more than 11,810 patients. This is because it happened to be Sathya Sai Baba's 90th birthday celebration. Next slide. This slide illustrates, the next 2 slides will illustrate the medical camp service activities at these in Prashanthi Nilayam. This slide shows the registration, BP check, weight check, acute care services, female outpatient exam, eye check with the distribution of free reading glasses, pharmacy, next slide, pediatrics, male outpatient exam, acute care, a diabetic patient getting blood glucose test, and diabetic education. In conclusion, I may add that serving in Sathya Sai institutions which offer quality health care with love and compassion at no cost to the patient certainly strengthens and unfolds our own inner urge to become a more compassionate doctor, or even more importantly, a more compassionate human being. Love all, serve all. Thank you.